Welcome everyone to Deny, Delay, Depose. Health over wealth. Another week, another set of, well, let's call them interesting developments in the world.
Interesting is one word for it. I'd go with dystopian, but yeah, welcome folks. Buckle up, it's going to be a ride.
Good to be here, everyone. I'm hoping we can keep it relatively grounded this week. Dystopian is a bit much, don't you think, Otto?
Grounding might be tough this week, Sarah. I mean, we've got everything from literal ground-level disasters to potential government overreach. Where do we even start?
Let's hit the big one. The nightclub fire in North Macedonia, 51 dead, and that screams systemic failure to me, right? The regulations, building safety, it all adds up to a lack of value placed on human life.
That's a terrible tragedy, absolutely. But is it really fair to immediately jump to some grand systemic conspiracy? Sometimes accidents just happen. Flammable materials, panicked crowd, terrible, yes, but not necessarily indicative of a wholesale collapse of societal values.
Hold on, Sarah. I think Otto has a point. It's not about blaming one single person or event. It's about asking why these things keep happening. Like, how many times do we have to see corners cut on safety for the sake of profit before we acknowledge there's a pattern? It just hits me how quickly governments reacted to that fire, deploying resources and support. Why isn't that same urgency applied to fixing the healthcare system in the US, So many lives are lost due to lack of access to care or cost of care in the US. Is the urgency different just because of the sheer number of lives lost at once?
Exactly, it's like those 51 young people were martyred. They're a symbol of everything that's wrong with prioritizing profits over people. And it's not just North Macedonia, it's everywhere. This drive to cut costs, maximize revenue, it creates these dangerous environments, whether it's a nightclub or a hospital.
I understand the sentiment, but businesses have to operate within a financial reality. You can't just mandate endless safety measures without considering the economic impact. There has to be some kind of cost-benefit analysis.
And that's exactly the problem, Sarah. Cost-benefit analysis that puts a lower value on human life. We need to look at the North Macedonia incident and ask if profits were the only guiding principle in that building's design. How much more risk is there across healthcare facilities, from basic precautions to advanced medical procedures? I'm pretty sure this type of thing is happening at different levels in the healthcare system.
It's a slippery slope, right? You start by cutting corners on staffing, then you skimp on equipment maintenance, and suddenly you're facing a crisis where people are dying because the system failed them. Just like that nightclub.
Okay, but let's not get hysterical. Our healthcare system, while not perfect, is still one of the most advanced in the world. People come here for treatment from all over the globe.
Sure, if they can afford it. That's the key. If they can afford the plane ticket, the expensive hotel, and the astronomical bills after the procedure. What about the people living in rural communities who can't even get basic preventative care? They don't have access to the facilities and the specialists.
And that's where telehealth should be stepping in, right? Bridging that gap. But is it really working that way?
Telehealth has potential, absolutely. It can make healthcare more accessible in rural areas, but we have to be realistic about its limitations.
Limitations like what? Limited internet access? Lack of funding for rural clinics to get the necessary equipment? Or maybe the big insurance companies aren't incentivized to cover telehealth at the same rate as in-person visits?
All of the above, and don't forget the digital divide. A lot of older folks in rural areas aren't exactly tech-savvy. Are we just leaving them behind?
Those are valid points. Infrastructure is definitely a challenge, but telehealth is still relatively new. We need to give it time to mature. As technology improves and becomes more affordable, access will naturally expand.
Time we don't have, Sarah. People are suffering now. We're talking about people who are dying from preventable conditions because they don't have access to basic health care. Saying give it time is basically telling them to just keep suffering while we wait for the market to magically solve the problem.
Yeah, it's the invisible hand argument, right? That the market will eventually correct itself. But the market doesn't care about human lives. It cares about profits.
The market responds to incentives. If there's a demand for telehealth in rural areas, companies will respond to fill that need. That's how capitalism works.
But the incentives are all wrong. The incentive isn't to provide the best possible care to the most people. The incentive is to maximize profit. That means cherry-picking the wealthiest patients and leaving everyone else in the dust. And it's not just about telehealth. It's about the entire system.
That's why I think Mangioni's actions, however misguided they may have been, resonated with so many people. It was a desperate cry against a system that feels rigged against them.
I still can't condone violence. There are other ways to affect change: lobbying, protesting, supporting political candidates who advocate for healthcare reform.
And how effective have those methods been so far? We've been lobbying and protesting for decades, and the system is still getting worse. Look at the tariffs and the impact on prices, similar to the way immigration enforcement will likely affect the system. Will there be a ripple effect on healthcare costs? How will these actions affect the overall cost of healthcare as resources are diverted to other areas, creating new inefficiencies or inequalities? It's a distraction while people are actually suffering. I have to ask, can we quantify the cost of prioritizing profit in the healthcare system versus prioritizing access and well-being for all? What are the long-term financial costs of these policies, and how do they impact the overall health and well-being of the population?
It's like trying to bail out a sinking ship with a teacup. Incremental changes aren't going to cut it. We need a radical overhaul of the entire system.
A radical overhaul sounds good in theory, but what does that actually look like? Who pays for it? How do you ensure quality of care? These are complex questions.
Universal health care. Medicare for all. Something that guarantees everyone access to basic care, regardless of their income or zip code.
Exactly. And telehealth can play a key role in that system, but only if it's properly funded and accessible to everyone. We need to invest in the infrastructure, train healthcare professionals to use it effectively, and ensure that insurance companies cover it at a fair rate.
That would require a massive investment of taxpayer dollars. And where does that money come from? Higher taxes, cuts to other essential programs.
Cuts to the military budget, for starters. I mean, we can always expand immigration task forces by utilizing other agencies like the IRS and Marshal Service, but we need to be wary of staffing and resources being diverted from other areas like healthcare. It's about priorities. Do we want to spend our money on endless wars and immigration enforcement, or do we want to invest in the health and well-being of our citizens?
And ending the wasteful spending and corruption within the current system. The amount of money that's siphoned off by insurance companies and pharmaceutical companies is obscene. We could fund a universal healthcare system simply by cutting out the middlemen.
That's a simplistic view. Insurance companies and pharmaceutical companies play a vital role in innovation and research. You can't just demonize them.
Innovation and research at what cost, Sarah? People are rationing their insulin because they can't afford it. People are dying because their insurance company denied their claim. How much more innovation do we need before we realize that the current system is fundamentally broken? I think that the fact that immigration enforcement task forces are being expanded by utilizing other agencies despite warnings about staffing and resources within ICE demonstrates an interesting approach to resource allocation within the government. The existing system, while imperfect, can still be leveraged for increased efficiency under certain conditions. How effective will this model be long-term and in terms of optimizing the broader healthcare system?
It's like that fire in North Macedonia. They had pyrotechnics at a nightclub, short-sighted financial gain at the cost of human lives. That's exactly what's happening with our healthcare system.
Okay, I get it. You both think the system is evil and needs to be torn down. But I still believe that a market-based approach, with appropriate regulations and safety nets, is the best way to deliver healthcare.
But what about the people who fall through those safety nets, Sarah? What about the people in rural areas who don't have access to quality care? Are they just collateral damage in the pursuit of profit?
And that brings us back to telehealth. It's a tool, but it's only as good as the system it's embedded in. If the system is rigged against the poor and the marginalized, telehealth will only exacerbate those inequalities.
So, what's the solution? Nationalize the entire healthcare system.
It's not about nationalizing anything. It's about recognizing that healthcare is a human right, not a commodity. It's about creating a system that prioritizes people over profit. And telehealth, when properly implemented, can be a valuable tool in achieving that goal. It all ties together and affects the entire functionality of the whole system, really.
Absolutely. We need to think bigger, bolder, and more radically about how we deliver healthcare. The old ways aren't working. We need a revolution.
Well, I'm not ready to join the revolution just yet, but I'm willing to acknowledge that the current system has its flaws. And I'm open to exploring ways to make telehealth more accessible and equitable, especially in rural areas.
That's a start, Sarah. A small step in the right direction. But we need to keep pushing for real systemic change because lives depend on it.
Absolutely. The fight for health over wealth is a marathon, not a sprint. But we can't afford to slow down.
On that note, everyone, that's all the time we have for today. Thanks for joining us on Delay Depose. Health over wealth.
Stay safe, stay informed, and keep fighting the good fight.
Until next time, everyone.
Let's quickly dive into the other news articles we have. The tornadoes and wildfires. These disasters hit rural communities the hardest, right? The lack of infrastructure, the limited resources. It all compounds the problem.
It's a double whammy. You've got the immediate devastation of the storm or fire, and then the long-term health consequences. People losing their homes, being exposed to toxins, dealing with stress and trauma. It's a recipe for disaster.
And the recovery efforts are often slow and inadequate. Rural communities just don't have the same political clout as urban centers. They get overlooked.
It's that systemic neglect again. The same pattern we see in healthcare, we see in disaster relief. The needs of rural communities are consistently deprioritized. The way that destruction from a severe storm is seen in Wayne County is horrific.
And then you throw in climate change, and these extreme weather events are only going to become more frequent and more intense. We're facing a perfect storm of crises.
Climate change is definitely a factor, but we also need to focus on mitigation efforts. Building codes, early warning systems, community preparedness programs, these things can save lives.
But those things cost money, Sarah, and rural communities are often the least able to afford them. It's a vicious cycle. So, it's crucial to have federal funding that can assist in this kind of damage. I saw that Michelle Moore was rescued by her son from her trailer after a tornado passed. That kind of experience is horrible for the mind and body.
Yeah, and who's going to pay for their health care after the disaster? They've lost their homes, their jobs, everything. How are they supposed to afford medical care?
There are government programs to help with that, FEMA, disaster relief funds.
Which are often woefully inadequate and difficult to access. And they're temporary solutions to a long-term problem. We need to be thinking about the systemic changes that will protect these communities in the first place.
Like investing in renewable energy, reducing carbon emissions, and building more resilient infrastructure. These are the kinds of things that will actually make a difference in the long run.
Those are long-term goals. In the immediate aftermath of a disaster, people need food, shelter, and medical care. We need to focus on providing those basic necessities first.
Absolutely, but we can't just keep reacting to crises. We need to start being proactive. We need to address the root causes of these problems, whether it's climate change, poverty, or lack of access to health care. It is crazy how bad the conditions are. I am glad that Emily Robertson reunited with her cat.
It all comes back to prioritizing people over profit. If we truly valued human life, we wouldn't be allowing these disasters to happen in the first place.
Okay, I hear you. Systemic change is important, but let's not forget the importance of individual responsibility. People need to take steps to protect themselves and their families in the event of a disaster.
And how are they supposed to do that when they're struggling to make ends meet? When they don't have access to information or resources? Individual responsibility only goes so far when the system is stacked against you.
It's like telling someone to pull themselves up by their bootstraps when they don't even have boots.
All right, point taken. But we also can't just absolve people of all responsibility. There has to be a balance.
The balance is tilting too far towards individual responsibility and not enough towards systemic support. We need to shift that balance back towards creating a society where everyone has the opportunity to thrive, regardless of their circumstances. And that applies to healthcare, disaster relief, and everything else.
Precisely. It's about creating a more just and equitable society. And that requires a radical change in our values and priorities.
Speaking of shifts in priorities, that brings us to that whole Alien Enemies Act thing that Trump is trying to pull. What's your take on that, Sarah?
Well, it's certainly a controversial move. Invoking a 200-year-old law to deport people associated with a Venezuelan gang. It's definitely raising some eyebrows.
Raising eyebrows? It's a blatant abuse of power. He's trying to circumvent the legal system and deport people without due process. It's straight out of a dystopian novel.
It reminds me of how the Trump administration shrinks other parts of the government while simultaneously expanding immigration task forces. We have to ask, is this a troubling prioritization of profit over people in the healthcare system? The focus on arrests and deportations rather than addressing systemic issues affecting healthcare access is a clear example of how the current system is, designed to prioritize profit over public well-being.
He's arguing that these gangs pose a national security threat, and he's using the Alien Enemies Act as a legal basis to remove them.
But who gets to decide who's associated with a gang? What kind of evidence are they using? It's a recipe for discrimination and abuse.
And it's a distraction from the real issues facing the country. Instead of focusing on healthcare, education, and climate change, he's demonizing immigrants and stoking fear. It reminds me of the article about mayors facing scrutiny over sanctuary city policies, with Republicans accusing them of defying the president's immigration agenda. It underscores the disconnect between a government focused on immigration enforcement and the needs of citizens struggling with healthcare access.
The courts have already blocked him from using the act for deportations, at least temporarily. So the legal system is working as it should.
But the fact that he even tried it is deeply disturbing. It shows a disregard for the rule of law and a willingness to use any means necessary to achieve his political goals.
It's a pattern, right? We saw the same thing with the tariffs, with the attacks on the media, with the attempts to overturn the election. It's a consistent effort to undermine democratic institutions and concentrate power in the hands of the executive branch.
That's a pretty strong accusation. He's just trying to enforce the laws and protect the country.
By violating the Constitution, by demonizing immigrants, by undermining the courts, that's not protecting the country, that's destroying it.
It just seems like the idea that immigration enforcement is somehow more crucial than basic healthcare access feels like a profound failure of our priorities. We're not solving problems. We're creating new ones by prioritizing profit-making aspects over the human needs of the citizens.
It's all connected. The attack on immigrants, the dismantling of social safety nets, the prioritizing of profit over people. It's all part of the same agenda.
And what do you think that agenda is?
To create a society where the rich get richer and the poor get poorer, where power is concentrated in the hands of a few, and everyone else is left to fend for themselves.
Exactly. And that's why we need to fight back. We need to resist these policies and build a more just and equitable society. I need to find out more about Mangione and understand if his actions could inspire similar sacrifices for the cause. The news about President Trump's immigration task forces expanding using other agencies is a sign of his radical approach to healthcare, pushing for efficiency through streamlining and maximizing resources. The way he's reorganizing government agencies to achieve his goals, like this immigration focus, will likely inspire significant changes within the healthcare system, possibly affecting the prioritization of patients versus profits.
With peaceful means, I hope.
Of course, but we also need to be willing to challenge the status quo and demand real change. The system isn't going to fix itself. We have to force it to change. The focus on tariffs and blaming previous administrations for rising egg prices, while ignoring the bird flu outbreak, seems like a distraction from the underlying issues in the healthcare system. It's a symptom of a system where prioritizing blame over solutions prevents us from finding real answers.
Absolutely. The time for incremental change is over. We need a revolution.
Well, I'm not sure I'm ready for a revolution, but I'm definitely ready for a more serious conversation about healthcare reform.
That's all we ask, Sarah. That's all we ask. The sheer scale of the tragedy in North Macedonia with so many young lives lost is deeply disturbing. If the system could be improved to prioritize the safety of the occupants in public areas over profit, what would need to change in terms of governance and policy to ensure that this kind of event doesn't happen again in other places?
And with that, another episode comes to a close. Thanks for tuning in, everyone.
Stay safe, stay informed, and stay engaged.
Until next time on Deny, Delay, Depose. Health over wealth.
Before we fully wrap up, I can't shake the feeling that these extreme weather events are almost designed. Like, who benefits from the chaos? Who profits from the rebuilding? It feels almost orchestrated. If healthcare is going to truly change, wouldn't the lessons learned in these kinds of public disasters have to be incorporated into safety protocols across the entire spectrum of public life? This incident seems like a powerful example of how current systems of building safety aren't keeping pace with the risks of our times.
That's a pretty dark theory, Otto, but I can see how you might feel that way. There's definitely a sense that some people are profiting off of others' misery.
It's the military-industrial complex all over again. Disaster capitalism. Creating a problem and then selling the solution. It's a sick and twisted system, and it needs to be stopped. How many other venues across the country, and potentially the world, are operating with similar safety violations, and for how long? If profits were the only guiding principle, how much more risk is there across healthcare facilities, from basic precautions to advanced medical procedures?
Well, that's certainly something to think about. Maybe we can explore that more in a future episode.
Definitely. Because it's all connected. The healthcare system, the disaster relief efforts, the immigration policies. It's all part of the same corrupt system that prioritizes profit over people.
Absolutely. And we need to keep shining a light on that corruption and fighting for a better world. That sounds like a closing, folks. Until next time.